Yes, we are go. We are ready to go.
Okay, thank you. Could I have this first slide? Thank you. Greetings, and thank you for joining this panel discussion on corporate funding and potential conflict of interest in public health. We have three great panelists coming up. I'm Rima Nakash, and I'll be moderating the session. I'm Associate Professor at the Faculty of Health Sciences at the American University of Beirut, and I co-coordinate the Network on Governance, Ethics, and Conflict of Interest in Public Health. This session is organized by the network, which is housed at the Faculty of Health Sciences at AUB and sponsored by IDRC. We are a group of individuals, academic institutions, and civil society organizations concerned with corporate influence on public health, research, practice, and policy. The network was established in 2018 and has up to 117 members to date from across the globe, with the majority of members from the Global South. It was created in response to the rise of public-private partnerships as a model of good governance to raise awareness and understanding of the challenges of engaging with corporate sector actors. To find out more about the network, you can go to our webpage on the AUB main website. We know that research evidence has highlighted a range of ways in which conflicts of interest that originate from corporate funding of research and practice can bias research findings and public health practice. The risks related to receiving funding for public health from tobacco, from alcohol, from pharma and gambling industries are well documented in the academic literature. University researchers, for example, caution against accepting funds because of the interference of industries in the research process, especially in data management and analysis, and the interpretation of results, and limiting researchers' autonomy in publishing findings. Corporate funding can also shape research agendas in ways that work against public health. There is a paucity of guidelines, and public health institutions receive funds from for-profit corporations. Consequently, corporate funding of academic research and public health practice varies across organizations, and in many instances, the decision to accept funding from corporations is left to the discretion of individual researchers or the institutions. As an introduction and to set the stage for our lovely panelists that are coming up, I will introduce now for a few minutes and highlight results from a study that was funded by IDRC, which focused on assessing attitudes and practices of public health professionals vis-a-vis taking funds from corporations. The study was jointly conducted by the Faculty of Health Sciences at AUB, by the James P. Grant School of Public Health, Brak University in Bangladesh, by the School of Public Health and Family Medicine in the University of Cape Town, and the Department of Health Services Research and Policy and the London School of Hygiene and Tropical Medicine. In its first phase, it entailed development of an inventory to assess accessibility and content of universities and public health schools policies available on their websites. And the project completed a web-based inventory using data publicly available and looked at what sorts of policies are available on those websites. The second phase looked at surveys to assess public health professional attitudes and practices. We conducted a stratified random sample of 50 universities, and those were selected around 5 regions in the world. Data was collected from schools of public health in those 5 regions: the Eastern Mediterranean, North America, Africa, Southeast Asia, and Europe. And data collection was implemented for each objective. Now, the preliminary analysis from the web-based inventory showed that half the universities that were looked at had a funding policy or a conflict of interest policy, and only 30% had both, and the majority of the funding policies addressed research. Of these, only 1/3 specifically addressed receipt of funds from for-profit corporations. So as you can see, there's a dearth of university policies that govern receipt of funds, and this is concerning. In the second phase, the findings were published recently, and the cross-sectional survey of attitudes and practices of public health academics, and the findings showed that over half of respondents were in favor of accepting funding from for-profit corporations. Although attitudes differed by world regions and gender, but not by rank, by contract status, by percent salary offset required, by their identity or exposure to an ethics course. And in the last 5 years, almost 20% said of respondents had actually received funding from for-profit corporations. And 60% of respondents agreed that there was potential for bias in a couple of aspects related to the research process when funds are taken from for-profit organizations. So we are organizing this panel discussion to provide a platform for interactive discussion on the topic and allow for the exchange of different positions in an intellectual environment and to promote professional learning about this topic. Our session today is built to achieve the following key objectives: to promote dialogue among participants on accepting funds from corporations which produce health-harming commodities, to draw attention to potential challenges for corporate funding and consequent potential conflicts of interest, to spread knowledge about the availability of guidelines to manage and mitigate potential funding from corporations, and to develop interest among funding agencies, scientific organizations, civil society, and academic institutions to develop policies to mitigate conflicts of interest. Our first presentation today will be by the panelist, Dr. Gary Fuchs. Dr. Fuchs is a reader of sociology and public policy at Aston University, Birmingham, and co-director of the Center for Health and Society. And Dr. Fuchs will present a series of case studies illustrating the range of conflicts of interest that can arise from corporate funding and their varying effects on health-related research and practice. Our next panelist is Dr. Neve Fitzgerald. She's president of the International Confederation of Alcohol, Tobacco, and Other Drug Research Associations. She's professor of alcohol policy and director of the Institute of Social Marketing and Health in the University of Stirling, and deputy director of Spectrum Consortium in the UK. The title of her presentation is The ICARA Principles. She will present on those principles that were developed to guide research organizations on developing their own policies on relationships with private sector bodies or other organizations where potential conflict of interest may arise or be perceived to arise. And our final panelist is Dr. Jihad Makhul. She's professor in the Health Promotion and Community Health Department at the Faculty of Health Sciences at the American University of Beirut. She's a member of the Jesse Public Health Network and is interested in public health ethics, applied research ethics, and structural determinants of health. Dr. Makhul will present as a case draft guidelines that were developed to assess potential conflict of interest from corporate funding partnership for the Faculty of Health Sciences as an example of how to adopt such guidelines in universities. So we will start with our first speaker, Dr. Gary Fuchs. If you can please share your slides. Thank you.
Okay, I'm assuming that you can see the slides. Okay, so it's sort of common to think about corporate funding of individual researchers, research programs, university departments, civil society organizations, and public institutions in terms of conflicts of interest, of course. And what I want to do is illustrate some of the effects and the shortcomings of the concept. Now, for those of you familiar with the area, you'll recognize that the concept is fuzzy and there are competing definitions. There is, however, a measure of consensus that there are two broad types, individual and institutional conflicts. On this slide, I've outlined three definitions of individual conflicts of interest from a journal publisher, and an institution, the WHO. They're all slightly different, but the underlying principle is that the competing interest may influence the substance of the individual's work. Now, in the case of research funding, the work on conflict of interest overlaps heavily with studies on the funding effect. The idea, of course, that funding shapes the findings of studies, how so research is reported, or whether it's reported at all. Much of the evidence on the funding effect comes from analyses of the tobacco industry, so tobacco industry sponsored research and reviews, and drug trials sponsored by pharmaceutical companies, which tend to draw pro-industry conclusions. Now, in respect of pharmaceutical industry funded research. Alice Nielsen studied 370 drug trials and found that studies were significantly more likely to recommend the experimental drug as a treatment of choice where a pharmaceutical company had funded the trial. The most recent systematic review by Lunt and colleagues found that industry-sponsored drug and device studies were more often had efficacy results that were favorable to sponsors' products and produce more favorable overall conclusions compared with non-industry sponsored studies. And there are lots of sort of potential mechanisms that translate interest into biased outcomes without the need for, if you like, fraud or scientific misconduct. And we can group them, we can group these methods, or we can group them into methods which relate to how the study is sort of set up and conducted, and methods relating to how the study results are then reported. They include how the question is framed, the design of the study, how studies are conducted, how data are analyzed, selective reporting of favorable results, spin in how conclusions are reported, and finally, publication bias. So there are a lot of ways, or a lot of what we can call inputs of bias. And interestingly, they vary according to their visibility and subtlety, which makes them really difficult to manage. So studies focusing on design bias in pharmaceutical trials illustrate this perfectly. Industry-sponsored studies, for instance, are more likely to test new treatments against inferior comparators rather than a well-established treatment with reasonable efficacy. Another practice is to test treatments against comparators with inferior or otherwise inappropriate doses. So Senior and colleagues looked at 58 industry-sponsored head-to-head trials of antidepressants and found that the sponsors' antidepressants were often given at a higher dose than the comparator. In other cases, the trial duration is set so that it's less likely to show side effects, and comparator treatments can also be inappropriately administered so that they don't work effectively. Now, by way of illustration, Johansson and Gotcha sort of highlighted a particularly subtle form of design bias in the case of trials of a new antifungal agent, fluconazole, in an excellent article published in JAMA in 1999. They found that fluconazole was being compared with nystatin in patients with cancer complicated by neutropenia, which is a condition where people have abnormally low concentrations of neutrophils or neutrophils. This was a problem because neutropenia renders nystatin ineffective. In addition, fluconazole was compared with patients who were orally administered amphotericin B, another antifungal medication, which is typically administered intravenously. The reason for this is that it's poorly absorbed orally. Now, whereas design bias is typically linked to conflicts of interest, publication bias, the failure to publish the results of a study on the basis of the direction or strength of the study findings, has multiple causes, including a perceived or real lack of interest in results from editors and reviewers. That said, sort of staying with the pharmaceutical industry for a moment, studies funded by companies which produce unfavorable results or results unfavorable to those companies are less likely to be submitted for peer review and published. Pharmaceutical company-sponsored trials are also more likely to be published prominently, and there is also evidence that positive results are reworked in different combinations and published multiple times. Now, publication bias is compounded by research contracts, which include provisions allowing for delays or the suppression of publication for commercial reasons. And this was sort of recently highlighted in Steele and colleagues' recent study of Coca-Cola research agreements. In addition to giving Coca-Cola the right to review research in advance of publication and control over study data and the disclosure of results. In some cases, the agreements also gave the company the ultimate decision about any publication of peer-reviewed papers. Now, one of the most instructive examples of the pitfalls of the gagging clause involved Betty Dong, a celebrated professor in pharmacology at the University of California. Dong's letter reported differences. Sorry, Dong was basically contacted by Boots the chemist, shortly after a letter she had authored appeared in a medical journal. Dong's letter reported differences in the effectiveness of various pharmaceutical drugs in treating people with underactive thyroid glands, and suggested that two branded drugs were more effective than comparable generic drugs. Boots was a manufacturer of one of the branded drugs, Synthroid, and signed a contract with Dong to undertake a bioequivalence test in the expectation that the test would demonstrate that Synthroid was superior to the generic drugs on the market. Dong performed the test, which showed that there was in fact no difference in the therapeutic effectiveness of the generics and Synthroid, which of course worked against sort of Boots's interests and was contrary to what they were expecting. Now, Boots then disputed her results and claimed that the study was flawed. They wrote letters to the head of Dong's academic unit and her vice chancellor, alleging that there were all kinds of methodological and procedural problems with the study, even though they had approved the research protocol in advance. Dong persevered and submitted a paper of her results to the Journal of the American Medical Association. The paper was peer-reviewed and accepted for publication, but prior to its publication, Boots warned her that she could not publish without its permission because of a restrictive covenant in her contract. Fearing litigation, Dong withdrew the paper. Now, the Betty Dong case illustrates a good illustration of funding relationships that are not effectively managed by declarations of interest in publications, which of course continues to constitute the key way of managing conflicts of interest in research, or at least one of the key ways. It also provides an excellent example of bias in the scientific literature that can occur despite the best interests of the researcher and despite the researcher acting ethically. Now, here the problem is not simply sponsorship, but the terms upon which sponsorship is accepted. By contrast, research on the impact of corporate funding on entire fields of research through the prioritization of topics that support the policy and legal positions of companies suggests that the converse can be true. In other words, the simple effect of accepting funding, irrespective of the terms upon which it's accepted, produces deeply problematic outcomes for public health knowledge and practice. Now, some of the best research on this issue has been undertaken by Alice Fabry and Lisa Barrow, who have examined projects supported by food companies. One study of RCTs published in 2017 found that studies sponsored by the food industry focused on some manipulation of nutrients in a context of a reduced energy intake. Now, this helped, of course, to underpin or helps to underpin the reductive focus of nutrients in nutrition research, and of course, a focus on nutrients rather than on sort of dietary patterns or interactions among nutrients within foods and within the body, produces evidence that allows the food industry to market highly processed foods using nutrient content claims. Now, a second study published in 2018 found that more than 40% of food industry funded studies in their sample focused on physical activity and sedentary behaviors. Now, this phenomenon, described by Marion Nestle as physical activity diversion, is of course key to industry alternative causation arguments for diet-related diseases. The bias, in this case to the research field, the entire research field, occurs irrespective of whether the researcher is affected by the conflict of interest beyond the point of accepting the funding in the first place. And again, it's not effectively managed through disclosure. And we know that sort of efforts to shape the field by companies like Coca-Cola are deliberate. In 2015, the company gave $1 million to the University of Colorado Foundation, a revenue stream that feeds into the university itself, to fund a research called the Global Energy Balance Network. The formal goal of the network was to provide a forum for scientists around the globe to come together and generate the knowledge and evidence-based pathways needed to end obesity. But Coca-Cola's real goal was to persuade people that they were focusing too much on calories and portion size and not enough on exercise. As part of the funding arrangement, Coca-Cola was allowed to choose the network's executives, draft its mission statement, and design its website. The company hired academics who received funding from Coca-Cola and other food companies in the past. Co-founder and president of the network, James Hill, for example, who is, I think, still a professor at the University of Colorado, had ties to PepsiCo, McDonald's, and the Sugar Association, and had previously received consulting fees from Coca-Cola. Another two of its founding members, so Stephen Blair, who's an exercise scientist at the University of California, and Gregory Hand, who's dean of the West Virginia University School of Public Health, have previously been awarded $4 million in research funds by Coca-Cola. Now, leaked emails obtained by the Associated Press suggest that the academics working within the network were happy to go out and bat strongly for Coca-Cola, despite the fact that that internal company emails made it very clear that as far as the company were concerned, the network was a political enterprise aimed at shifting the dialogue on obesity away from calorie consumption and toward exercise, and basically countering public health practitioners and scholars who thought this was a bad idea. Okay. In the event, the University of Colorado handed back the money from Coca-Cola, but only once the network's underlying motives and funding stream had been exposed. So one question, and I'll finish on this point, is whether this sort of funding is captured under the definition of institutional conflicts of interest. Now, the definition on this slide, so the definition of institutional conflicts of interest on this slide is from the Institute of Medicine. And if you read it, you'll realize that the obvious question, of course, is what is the institution's primary interest and mission? In an era where scholars and departments are judged on grant capture, I don't think it's altogether entirely clear. Thank you for listening. Cheers.
Thank you, Gary. Our next speaker is Dr. Neve Fitzgerald. Neve, are you ready to upload your presentation?
Hello, everybody. I'm just going to share. Need Gary to stop sharing first, I think, and then I can share. Yes, thank you. It's lovely to see some of the questions and comments coming through on the chat as well. So we'll keep an eye on that as we go. So it's a bit slow, I think. Hopefully you can see that now. So it's lovely to be here. I'm Neve Fitzgerald. I work at the University of Stirling, and I've kind of got a couple of hats on today. So I'm part of the Get BPH board, and delighted to be here. And thanks, Rima and colleagues, for having me. But I'm also part of an international confederation of research associations focused on alcohol, tobacco, and other drug research. And I'm going to talk to you just now about some principles that might guide research organisations on developing a policy for interactions with actually any organisation where there might be a funding arrangement or a potential conflict of interest. Just very briefly about the CARA that has written this guideline. We're an umbrella organisation. Our members are other organisations. So, for example, we have members like the International Society for the Study of Drug Policy or the Australian Society on Alcohol and Other Drugs as well. So we try to bring people together for professional exchange and collaboration and networking. It's obviously tricky in current times, but one of the things that we focus on is trying to avoid duplication of effort across our member organisations. And it became apparent that several of our member organisations were trying to develop policies to manage conflicts of interest, and this was quite a difficult process. So we've tried to help with through these guidelines. So the history of the debate amongst our member organisations was quite difficult. The debates were disruptive. People took positions that surprised other people in membership organisations. There was significant potential for these discussions about how to manage conflicts of interest to divide and distract our member organisations from other work. But at the same time, many people also felt that it was very important to decide on how to move forward with these because of the issues that Gary has raised and other issues. But there was also little sense, I think, that there was cross-organisational learning. So we felt as though our member organisations were grappling with developing policies separately when actually the issues that they were facing were quite common across the members. Having said that, most of our member organisations didn't have a completed policy. So whilst there were some that were trying to develop one, there were very few, if not none of our members that actually were able to say, you know, this is our policy for managing conflicts of interest. Some had policies around declarations or requiring declarations of interest, but not specifically about how to handle the governance of their organisation if a conflict of interest arose, or what any red lines were, I guess, in terms of what level of conflict of interest might mean that somebody might be excluded from a discussion or from governance or from a body within the member organisation. So there were a couple of parallel processes that went on within ICARA, looking at the alcohol industry specifically and then looking more broadly. And those were merged into the guidelines that we launched last year at the Lisbon Addictions Conference in October. And that's what I'm going to present to you just now. I thought it was useful just to share this quote from one of our colleagues who worked on the original guidelines. In that the aim of the guidelines is not to tell organisations what to do or what not to do. It's to enable them to work out what might be right for them. So the guidelines are not saying who you should take funding for, who you should work with or not, but presenting a process by which an organisation might come up with a policy that works for them in terms of their interests and their priorities and where their own red lines are. So that's the purpose of these guidelines. So the guidelines themselves are divided into 5 sections. I'm not going to dwell on the first 4. I'm going to focus mainly on number 5, which sets out kind of 3 overarching principles. But just very quickly to flag, the guidelines do mention that it can be any external relationship. So I think there can be a perception or a real conflict of interest, not just with private sector organisations. Obviously, private sector organisations are very powerful, have a lot of funding, have the ability to, for potential for harm, I guess, in terms of the relationships between research organisations and private sector bodies is higher. But undoubtedly, there are also charities, government organisations that have specific interests, and they may seek to pursue those through relationships with research organisations, and they may use some similar ways, like gagging clauses, for example, in government contracts, that may undermine the science or may affect scientists' potential to be objective in terms of deciding what to publish and when. So it's not to say that the same level of conflict arises, of course, as with some for-profit organisations, but to be mindful that the same principles can be applied to those relationships. And then sections 3 and 4, I think, talk about potential benefits and risks of interactions with other bodies where there might be a conflicting interest. So if you're receiving funding from another organisation, I think Gary's presentation has been really helpful in terms of thinking not just about whether it biases the research that might be conducted or the activities that might be conducted. And he's also reminded us that it's a potential bias across the agenda. And I guess what we refer to in the ICARA guidelines is also taking that to another level, which is about in what way does working with, for example, an alcohol industry organization or an e-cigarettes company or whoever else, you're sort of lending, if you agree to enter into a working relationship with another organization, you are to a certain extent lending your credibility or reputation to that funder, and potentially therefore enhancing their influence at a societal level in political discussions and policy discussions, lobbying and so on, that they might be engaged in elsewhere. They can point to their relationship with you, and that is another consideration. So even if they're not dictating the agenda and they're not influencing the quality of the research in any way or biasing the research in any way, there's still a societal level potential reputational benefit that you need to be mindful of, and ask, I guess, whether you're happy for your reputation to be lent to them in that way, and what the kind of system level harms might be of that. Obviously, for any research organisation considering receiving funding, there's that sense of a perceived endorsement. There's a risk of your own reputation, perhaps them lending their reputation to yours. So you need to be happy that the reputation of the funder is one that you're happy to be associated with, as well as I think the issues that Gary's highlighted very carefully around potential bias and conflicts of interest. So those are discussed further in these short sections in the document. So moving on then, just to talk about the 3 principles in the document for decision making around policy development for conflicts of interest. So first of all, if approached or considering entering into a relationship with another organisation whereby they might be funding you or they might be giving you in-kind support, due diligence is the first principle. And there are other documents that you can look at that set out this process, I think, in a lot of detail. It's summarised in the ICARA guidelines, really in relation to 3 main areas. So the first one is follow the funding. So work out where the funding has come from, who is providing it, where have they received the funding from, and actually follow that trail back. So sometimes what you find is that an organisation may be funding you, and they may look okay, but they may have been given that money by someone else who's given that money by someone else. And actually, when you follow the funding back, it may eventually reach somebody that you're less happy to work with. I think that's one of the critical things. What's the original source of the funding? The second main point is, what are the alignment of aims between you and the funder, or indeed the original source of the funding? So I guess considering whether their reputation and activities are aligned with what you're trying to achieve as a research organisation, aligned with your principles and values. And considering that from the societal perspective is clearly really important there as well. I'm seeing something pop up on my screen whenever there are comments, I think, so please do let me know if I'm running over time. Then the third area in relation to due diligence is considering the funding arrangements. So what are the conditions on the provision of the funding or the provision of the in-kind support, or indeed whatever relationship you're entering into? There's a tension here, I think, between transparency and publicity. So you obviously want to be transparent about whatever relationship you're entering into. And if in being transparent, you're concerned that you're giving, I guess, publicity or marketing airtime to the organisation that's funding you, then there's a tension there that maybe says that you need to go back to your alignment. So if you're not comfortable with them with the funder talking about how they have funded you and what a great partnership they're in with you, then there's a question mark there, I think, about whether you should be in that partnership to begin with. If you don't feel comfortable being transparent, that would ring alarm bells, I guess. So that's the first principle, really, is considering the due diligence. And the last point on this slide really is just thinking about that, not only in relation to the individual organisation offering support. So, for example, if I take the area I know best in terms of the alcohol industry, there may be very small players like local microbreweries who are in themselves not engaged in any political activity or lobbying or marketing that you might feel uncomfortable with. But they're obviously part of a broader grouping or industry. And then it's also possible with all of these smaller bodies that may seem relatively innocuous in terms of what they're doing, that they will be taken over by a body that you're not comfortable then being associated with. So it's just being mindful of that as well in terms of corporate mergers. The second main principle then is on open decision making and policy. So this is really about how you develop your policy. So transparency is the third principle, and that's really once the policy has been developed, that's how we present it here. So the principle here is about, you know, having really a thorough and open discussion with all constituents of your research organization, to think through what are the ethical and practical implications of whatever the potential rules or funding arrangements might be that you're coming up with, and to develop your general guiding principles and procedures. And I think the devil is really in the detail here, in that it's sometimes relatively easy for everybody to agree on broad principles. And where I've found in my experience in working with IDRC and other organizations, it becomes much more difficult is in actually translating those principles into procedures and protocols. So people can be quite happy to agree to kind of sort of, you know, we don't want X, we don't want Y, but then when it comes down to translating that into who is allowed to take part in a meeting, who is allowed to take part in the governance of your organization, that becomes more tricky, I think. And as an example of that, one of the things that we came across when we were working with Inebria was we wanted to gather declarations of interest from all of our members. And the question and objection to that was really raised by some members saying, what are you going to do with the declarations of interest? So I suppose they were really saying, you know, it's all very well gathering them, but are you then going to publish them somewhere where everyone else can see them, where they're available publicly? Can they then be misused perhaps by other organizations or industry organizations against us? So I think it's that thinking through of what's the purpose of the procedures and how will we view them? And that sometimes can make it very difficult to agree. So I think unless you really have bottomed out your thinking as to the end point of some of the sort of fairly simple things that you might agree around transparency, transparent to whom, when, and how, it can be difficult to actually agree on a policy, and that can actually sort of take a lot of time and sort of makes people sometimes very fed up with the whole process, which seems, you know, fairly straightforward and well-meaning to begin with, but then you get sort of bogged down in what if this and what if that, and that can be quite slow. But whatever you then agree, I suppose the point here is that sometimes even with details on policy and procedures, where these things can fall apart is that people then don't necessarily implement the policy and procedures. So it might be there on paper, but somebody perhaps still needs to speak up to say, well, wait a second, you know, X person has this conflict, so does that mean they should be part of this conversation? And so you still need quite a deal of buy-in from the leaders and the governance of an organization to see this through, no matter what you have on paper, I guess. And then the final principle is around transparency and how the policy is applied. So once you have a policy in place, then it's about communicating that to all members, all members of the team, members of the organization, in a way that establishes norms. So this can also be tricky. So it might be that that you've secured agreement on a particular policy, but that not everybody within the organization is on board with that decision. And so there's a kind of normalization process that then needs to happen where people get used to the implementation of the policy. An example of that might be, for example, conflicts of interest statements in conference presentations. So people quite often don't want every single presenter on every conference to say whether or not they have conflicts of interest related to a topic, but it would be relatively straightforward to make conflicts of interest statements available alongside the agenda of a session, so that people could at least see them without everybody having to put a slide up around what their statements are. And I guess it's thinking through, you know, going back to the point about gathering declarations of interest and not sharing them. I suppose when people are presenting or when people are speaking in a meeting, that's when other people really need to know what their declarations might look like in order to be able to take that into account. And I think that's the final principle, I guess. Transparency runs through all of it, I suppose, whether it's due diligence or whether it's the development of the policy. It really helps for all of that to be transparent. But it's also, I think, there are difficult decisions to be made on where that level of transparency ends. So does it end with the members and say maybe partners and collaborators of a research or organization, or should that also be made available to the general public? And I think that's a little bit trickier, where it then maybe can be used in ways that might not be helpful depending on what's in the declarations. But I guess in conclusion, one size probably doesn't fit all for policies on conflicts of interest. It very much depends on the extent to which people are, say, for example, doing public health research compared to research on medicines or research on other aspects of health. You know, we do offer a service to our members in terms of supporting them to develop conflicts of interest policies, but it's difficult is I guess where I would conclude, and it's difficult I think at university level as well, and I know that's what we're going to be going on to talking about next with Judy. So I'll just finish up there, but thank you very much for your attention.
Thank you, Neve. You did very, very well on time. So thank you. So our next speaker is Dr. Jihad Makhoul, speaking about guidelines for decision-making to safeguard against conflict of interest and partnerships with corporations for public health, a case study at the Faculty of Health Sciences. And I want to invite everyone to put in their questions at the Q&A because we're approaching the end of our symposium and we would like to have an opportunity for discussion and questions. Thank you.
Hello? Hello?
I can hear you. We can
Yes.
hear you.
Okay. Rima, can you allow my video? It just says that. Can you see my screen as well?
Yes, we can see your screen and we can hear you.
Okay.
We just need to.
Okay. Great. Okay. Good day, everybody, and thank you for joining us. This is my talk is going to be about an example of how such guidelines have been started or are starting to develop. So this is I'm going to talk to you about the draft guidelines that we have so far and the process so far related to decision-making to safeguard against conflict of interest with partnerships, specifically with corporations in public health. And this is related to what we did at the Faculty of Health Sciences at the American University of Beirut. And I thought it was interesting for me to start with this quote about the conflicts of interest. They are there, they are real. Even though some researchers, some universities around the world really do not know that they are there or do not acknowledge their existence. There is a blind spot. And they are there because this corporate world is interested in increasing their visibility and their reputational benefits. So they partner with universities and with humanitarian agencies. So then there's a blind spot at our level, at the academic level. And as Rima just presented in her opening, the study that she did found that a lot of universities around the United States have no problem with partnering with corporations. So this presents conflicts of interest. They are there, and they have consequences. but they can be tolerated so long as we acknowledge that they are there, we detect them, we foresee them, and we try to manage them. However, we need to remember that there could be some added benefits to this partnership. So just a little bit of a background in the context where this is happening at the Faculty of Health Sciences at the American University of Beirut. We're always, looking for funds, like a lot of universities, to propagate our research, to conduct practice and service and training. So we're approached by corporations to do different kinds of things on an individual basis. So corporations would approach a faculty member, a unit that we have. However, over the years, many of us have thought about a possibility of a problem of conflict of interest and influence from these corporations. However, we have no clear guidelines or policies to help us navigate this. And over the years, it has been an ad hoc process where the dean had to clear this partnership after consulting with an advisory committee and a number of colleagues of ours. And so then recently in 2018, I think, we were, as a faculty, approached by a Danish multinational pharmaceutical company to conduct research with refugees and to do an assessment of diabetes in Greater Beirut. So the dean asked Rima and myself to come up with some guidelines and think about what we could do to help ourselves sift through and decide whether we would accept such partnerships or not. So there has always been this dilemma. And we've never actually had an open discussion or dialogue at the faculty, even though many of us were interested to do that. Sort of an intellectual hour where we could start debating and sharing information and start a dialogue about that. Because many of us in the faculty accept and are taking funds for research and teaching and workshops. And some of us have refused or think critically about it. So there's been a dilemma. We haven't resolved it, and we've never talked about it. And the American University of Beirut, established in 1866, is a US-based university, and it's supposed to follow US federal laws. And as you can see, in 1980, one interesting act removed the ban on campus entrepreneurship and collaborations with corporations. However, in 1995, new regulations require institutions to establish standards and procedures to avoid bias from conflicting interests of the investigator. And in the university now, the only no-no we have is related to accepting funds from tobacco corporations. And this is part of a tobacco-free campus initiative that has built on a tobacco-free or a smoking, a no smoking policy at AUB, which strictly prohibits taking money from tobacco corporations, but nothing else. So the aim of our guidelines, we thought that we should clearly state them, and these guidelines should be read by and looked at by other faculty members who are not very much in this context and who are not attuned to issues related to ethics and conflicts of interest with corporations. So we aim to produce a guideline that helps fellow colleagues at FHS become more aware of these challenges in industry, in relationships with the industry, encourage them to interact with their institution, to address these challenges, and promote measures and mechanisms to advise, to guard against, and to foster transparency and accountability, to have an open discussion and put in place a mechanism to advise ourselves on how to go forward. So first of all, we had, of course, a review of relevant literature around similar guidelines. And we had a look at them and we decided, what could work in our context with a good understanding of the context that we are working in. The Arab world, Beirut, Lebanon. And so we had multiple drafts that we put together and we shared with the dean and we had comments. And then at the end, we had a meeting at the faculty advisory board. And it was just a few minutes at the end. We barely had enough time to present it. However, when we did present it, it was received with a lot of doubt from the members around the table. Even I wasn't there, I was there, I was presenting it. And there was sort of suspicion, why are we doing this now? And then we decided that we were going to postpone these discussions to another advisory committee. And when that happened, we also didn't have enough time and it did not get discussed. And we have an interim dean now, so, and she's busy with other things, and this is still tabled for discussion. So then, of course, a lot of what my colleagues were talking about have actually found their way into these guidelines, because we were looking into the literature about what these guidelines would include. And of course, there are a number of guiding principles that we thought are important for academic investigators themselves, for the sponsors, and for both sponsors and academic researchers. And as you can see, for academic investigators, principles around their responsibility to their institutions, professionalism, obligation to unbiased research, establishing a data analysis plan, a memorandum of understanding, and sponsors need to be involved in reviewing the data and the research results at a timely manner, etc. So then we came up with guidelines that were formulated in sort of like 3 steps. But whoever would be looking at these or assessing these steps or studying these steps would be a group of people in a review committee, which we suggested would include a facilitator from the faculty or outside, independent volunteers, and the PI to be involved in discussion and for information. And all of these discussions, as I will explain in a moment, should be carefully documented for the record. But what was clear in the guideline that we suggested is that we should not at all even think of or accept even thinking about or discussing relationships and partnerships with commercial enterprises whose work products are incompatible with the mission of the faculty and public health, and whose products are health harming. So these are suggested guidelines for vetting the request. And it's sort of like step by step, and it goes into 3 rounds of assessments that the committee should be involved in. So at the very beginning, there's a lot of assessing the ground. So a due diligence assessment about the agency or the company or the partner itself, to understand their backgrounds, how their interests might or might not conflict with the Faculty of Health Sciences interests, what their track record are, a little bit more of investigation at that level. And this should be not done just there if it turns out that we will partner partner with them, we need to continually keep an eye and repeat this assessment throughout the life of the project if it does see the light. And then, so if the track record is deemed acceptable by this committee, then we will continue to the next step. If the track record is deemed unacceptable, then we should decline the funding. And of course, this is documented. So then if we go to step 2, then we need to do a round of assessment of the project itself, or the proposed study, or the partnership study, or whatever it is that we are interested in. And to understand the project content and the risks on the faculty and on the leadership role, and the benefits and risks to the faculty, but also to the public. So if that is deemed unacceptable, doesn't work, then we decline funding. If it's okay, then we go to the 3rd step. So then the 3rd step is another round of assessment to talk about, to understand actually the feasibility. Are we ready to do that? What's going to happen in the future? Any unintended consequences? So that is basically what the suggested plan very, very quickly. And so then if we do accept partnership, then we need to be preparing ourselves to make sure that there is effective communication, a detailed memorandum of understanding, who's going to do what, what the responsibilities are, who's going to do the monitoring, and deliberations are also documented, and the same review committee will continue to be involved. So then at the end, we have also a footnote that in case the potential partner's goal is just product endorsement without benefit to public health or the general society, then we will not engage. Also, if the partners or the potential partners' focus is just donor recognition, like a lot of groups that I know, then we will not engage. We will also not engage if the potential partner has a problem with a publication of research results and just wants to do this partnership without any outcomes. And also, most importantly, of course, the risks outweigh the benefits to public health and to the faculty. Thank you very much.
Thank you, Dr. Mahoul. We have, according to the system, 16 minutes left for questions, and I can see that there are a few questions on the chat Q&A. I will start with one that was also almost partially addressed, but which I thought was interesting, by Upendra. Upendra is saying, asking what are some key sources or databases for industry materials, and she refers to the tobacco industry document repository as a source in UCSF, which actually houses the once confidential tobacco industry documents. And my question, I think perhaps Gary, if you can address this question, are we aware of any similar sort of repositories or sources of industry material from other industries such as food, pharma, or perhaps alcohol that can be useful to understand the practices of those industries as the tobacco industry documents allowed us to understand their workings?
Okay, can you hear me?
Yes. Please
Okay.
go ahead.
I mean, the sort of tobacco repository doesn't only contain tobacco industry documents. It contains also obviously documents from the sugar industry and the agrochemical industry. And there's also, I mean, the problem we have really is that it's only really primarily in the US where there have been sort of legal actions against companies and where the disclosure rules are really sort of quite aggressive and expansive, that industry documents tend to be released and made public in litigation. In the rest of the world, that's sort of the opportunities, if you like, for knowing what companies are doing are relatively limited because the legal systems are very different. Does that help?
Yes, thank you. And I also wasn't aware about the sort of repositories on sugar and other agrochemicals under the UCSF repository. So that's useful to know. Thank you, Gary. Another question that I would like to address, which some of the questions are addressed in the live Q&A, so I might skip those. But there's one question with regards to that says that in basic and biomedical sciences, the academic industry partnerships are promoted by a state. However, the state also regulates academic institutions doing public health, and that the Upendra finds it difficult to make a case for much caution against industry partnerships. So what are experiences from our respective countries that we can respond to this question on or comment from Upendra? Who would like to take up this question?
Vima, is this question posted? I can't see it. I would like to read it again because I didn't hear the last part.
It is posted. The questions you need to sort of scroll up and down.
The questions are on the HSR website rather than on the Zoom chat. I can cover this a little bit. I think it's really tricky, and it's tricky, I think, because these sorts of issues can seem really black and white to public health researchers, and it seems really obvious to some of us what the potential harms are from engaging in a relationship with a big alcohol company or a big tobacco company. I think whilst tobacco maybe we leave out of this, there are other areas that are a lot grayer, especially around food and pharma and so on. But because the organisations that we're funded by, whether they're government or fund, other research funders, also fund other research, not just public health research, that's where it gets tricky. And I think where the way forward with this has to be kind of baby steps. I think if you try to solve everything at once, you'll possibly reach a brick wall. So whether it's within your university or within a research funder, if you can kind of say, right, let's look at public health research and let's look at what's appropriate and what's not appropriate within public health research first. And that sort of at least starts to establish some norms that might then trickle through into thought processes in other areas about risks and benefits, like Judy has presented, I think. So I think it's starting small and trying to say, okay, we're not trying to stop you partnering with everybody in every aspect of what you do, but could we look at whether it's appropriate to partner in relation to public health research with X organizations?
Thank you, Nif. If no one else of the panelists would like to address this, I have a question, because I thought, Nif, you touched on it with regards to the need to have buy-in for leaders, that it's important for them to be supportive and to have ownership of at least the process of developing the policy, and of course eventually the policy. And that sort of also resounded with Judy's presentation, because there is in order to sort of go through with the set guidelines and adopt them at an institutional level, you would need ownership from leadership. What would you suggest as a way to achieve that for people who are in such institutions, who are cognizant of a potential conflict of interest and see a value of coming up with such guidelines? How would you suggest we can achieve that? And
I can say a few words.
Sure.
So the question is, with people who are cognizant, so you're saying, so let's just say there are a group of researchers and academics like us who are, who recognize that there are potential conflicts of interest, and we need to spread the word. And how do we influence our university to adapt or to adopt some sort of guideline? I think what from our experience, what is not there yet and what should be there is a dialogue, first of all, an open dialogue that sets the stage or gives an opportunity for people who are with and maybe not with or against, or who are neutral or who don't know anything about it. A series of discussions to bring these issues up and maybe have a platform for this kind of conversation, and a series of those for people to maybe at the same time read and have an intellectual discussion. So if the university is not the place for an intellectual discussion, where would we have this intellectual discussion, right? So I think that's the first one there. And then maybe on the other hand, integrate these ideas into the practices of maybe a department, or start slow, start low, and have examples and have an open, discussion and a forum for discussion where these things might need further deliberations. So make the environment for the faculty members, for researchers, enabling and supportive of their an open environment where people can discuss and talk about. But then when you have people on board, and I'm just thinking out loud, I could be mistaken, when you have few people on board and people who are with, then you can take this group and move forward with a plan to advocate for such policies. And so I think transparency, dialogue is very important, and a strategy.
Thank you, Judy. Nif, would you like to add to that?
Yeah, I think so. I think one of the things that I have found, and I hope everyone can hear me okay, is that sometimes this debate is a moralistic one, and that's very unhelpful. So if it's set up as there being rights and wrongs, I think it makes it really hard to actually bring people with you in discussing what a policy should look like, especially at the start, because people feel threatened and they wonder if what you're doing is saying that, they've made a bad decision by having a previous partnership. And I think moving it away from a moralistic discussion to a more scientific discussion is really helpful.
That's why I recommended, having a paper, and let's discuss this paper that gives the pros and the cons, rather than saying, what you did last week, accepting money from a big pharma, there are implications, they want their logo, and this is problematic for us and puts us in a bad spot. I agree with you totally. Yes.
Okay, thank you. So I'm looking through the live Q&A part, and there are a lot of questions with regard to resources, and thank you for all of you of the panelists who have provided some of those resources. I also want to invite members and participants to connect with the network if they're interested in learning more about this topic and in moving forward the knowledge around and evidence around this topic. I'm looking through the rest of the questions, and I think that so far there are no new questions that are coming up, unless some of the panelists would like to add or follow up on a point that was previously raised or mentioned. Can I follow up, Nif, on the question with regards to the ICARA guidelines? How does ICARA intend to sort of see how those guidelines are taken up and evaluate them in various contexts? Is there a plan to do that?
There's not really a plan at the moment, if I'm honest. So I guess we're still in the process of trying to work out what our members are doing with them. That's the first stage. And we don't have a lot of members because our members are big organizations. So there's sort of about 10, 15 members. I know that some of our members are going through processes again now where they failed to put in policies in place before, but they're now going to use our guidelines to help take that forward. I don't really anticipate that that's going to be all that much easier for them than it previously was, though. And yeah, that would be my main sort of take home from this, is that that you've got to sort of be ready for a long, slow process and kind of build your energy and think in terms of not expecting it to be easy to do this, but at the same time being quite open in the conversations that you're having, and just kind of keep chipping away at it with people. I think it's a process of normalization of a new way of working for a lot of people and a new way of thinking, and I think that just takes a bit of time to have those conversations.
Okay, great. Thank you. Thank you. So if panels don't have anything more to add, and I want to close the session, I want to thank everyone for joining, and I hope that we gave the topic enough time and effort, and that we highlighted the challenges of corporate funding that you can take back with you to your institutions and organizations and colleagues, and sort of promote dialogue around this topic. Thank you very much.
Thank you.
Thanks, Rima.
Thank you.
Thanks, everyone.
Thank you. Bye-bye.